Good morning, everyone. How are you today? You look great. So today, our chairperson, Honorable Vanethutai Rose Toki Brown of Cook Islands, has to attend to important matters. I have the privilege to take over, and I will do my best to ensure the efficiency in the conduct of the proceeding. Before we begin, delegates are kindly requested to forward their interventions in advance of delivery as soon as you can to the following email address. This will help the interpreters support you in conveying your important messages. WPRCM intervention at who.int, no spaces. So we will now move to begin our consideration of agenda item 15, specifically 15.2, WHO's work in countries, document WPR/RC 75/10. May I call on the Dr. Susan Mercado, Director Program Management, to introduce this agenda item.
Thank you, Madam Chairperson, distinguished representatives. It is my pleasure to introduce item 15.2 on WHO's work in countries. The item started as a side event in 2016 and went so well that the Regional Committee decided to make it a regular or a standing agenda item in 2019. This item offers snapshots of the work WHO is doing across the region's 37 countries and areas. This session gives us an opportunity to reflect on the progress we have made together and the significant impact our work has had at the country level. The various strands of the new Western Pacific Vision document will be at the forefront of our shared efforts to address country needs and priorities as we accelerate and work on this toward the future. The region is rapidly changing with new and evolving challenges, and we are employing innovative ways of working to maximize and sustain the benefits of our work together. And most of that innovation comes from you. The region is very happy to see today and hear from the countries how collaboration and innovation is progressing and its impact on the people. I would like to now call on Dr. Nino Dayanghirang, who's the coordinator for country support, to introduce our speakers. Thank you very much.
Thank you, Doc Susie. So to start the work of the work in country session, we would like to firstly recognize the WHO representatives and country liaison officers with us for RC 75.
Okay, so they're doing a round of our WHO representatives. Let's give them a round of applause, please.
So RC 75. So RC 75 is one of the few RCMs where all the WHO representatives and country liaison officers are participating. Thank you very much to the dedication of the WRs, NCLOs, and their teams in the WHO country offices towards ensuring results are achieved with the Minister of Health and partners. Today we share stories or examples from several countries across the region that describe the noteworthy progress being made on implementing the regional vision. Our first stop is Cambodia, where we will present a video on health security and emergency preparedness and response, and then His Excellency Dr. Loh Vianaskiri, Secretary of State for Health for the Kingdom of Cambodia, and Dr. Mariana Trias, WHO representative to Cambodia, will share an update after the video on recent developments in the country.
នៅក្នុងកំឡុងផ្ទុះ COVID-19 ការងាររបស់មន្ត្រីសុខាភិបាលនៅថ្នាក់ស្រុកយើងគឺមានការជួបការលំបាកជាច្រើនយើងសង្កេតឃើញថាយើងមើលតំបន់ណាដែលមន្ត្រីយើងគឺគាត់នៅមានភាពទន់ជាពិសេសគឺតំបន់ព្រំដែនតែម្ដងការគ្រប់គ្រងតាមច្រកព្រំដែនគឺថ្មីពីខាងក្រៅចូលមកក្នុងប្រទេសកម្ពុជា ដល់ប្រទេសកម្ពុជា ហើយក្រៅពីនោះទៀតគឺក៏យើងនៅបានពង្រឹងប្រព័ន្ធតាមដានជំងឺឆ្លងគឺតាមការណែនាំរបស់ក្រសួងសុខាភិបាល
ចឹងនៅពេលដែលប្រជាពលរដ្ឋយល់ដឹងពីការថែទាំសុខភាពអានឹងមានន័យថាសុខភាពសាធារណៈយើងដើរបានល្អហើយអញ្ចឹងតកតងនឹងអាជ្ញាធរក៏ដូចជាមូលដ្ឋានសុខាភិបាលយើងគឺយើងបង្រៀនមួយទៀតផ្ដល់ចំណេះដឹងមួយទៀតតកតងការបង្ការការឆ្លងរោគគុំគឺយើងផ្ដល់ការកសាងបណ្ដុះបណ្ដាលដល់ជនគន្លឹះសហគមន៍គឺយើងបរិញ្ញាក្រុមប្រជាពលរដ្ឋចូលរួមទេយើងអាចធ្វើការតែឯងបានទេយើងអាចជោគជ័យបានទៀតចា៎ ទន្ទឹមយើងបានជោគជ័យក៏ដោយសារមានកម្មវិធី WHO គាត់បានគ្រប់គ្រងយើងទាំងបច្ចេកទេសកសាងសមត្ថភាពបងគាត់មកបរិយាយើងពីរបៀបធ្វើសមយុទ្ធទៀតចា៎ហ្នឹងគាត់ជួយយើងនិយាយទៅទិសដៅគឺធ្វើម៉េចឲ្យជាបរិបទបានសុខភាពល្អទាំងអស់គ្នា
Good morning. Thank you for giving us the opportunity to present a key health action from Cambodia from the past year. In 2024, under the leadership of the Ministry of Health and with technical and financial support from WHO, the Royal Government of Cambodia conducted its second Joint External Evaluation, or JEE. The JEE is a voluntary process to monitor and strengthen a country's international health regulations core capacities, which are essential for preventing, detecting, and responding to public health threats in our increasingly fragile and unpredictable world. Cambodia conducted its first JEE back in 2016, and Cambodia is only one of the two countries in the WHO Western Pacific region to request a second JEE. This proactive approach to the evaluation of the country's health security and emergency systems demonstrates Cambodia's commitment to improving its preparedness and response and to learn from the many lessons from the COVID-19 pandemic.
Very good mornings. It was an exercise step for Cambodia. The country regularly deals with public health events and outbreaks like avian influenza, mpox, dengue, and seasonal floodings. Though through collaborative across the various ministry, agencies, and partners, the JEE evaluated 19 technical areas, including surveillance, laboratory capacity, recommunications, health emergency management, human resources, chemical event, and other essential health system components. The recommendation from this critical process have contributed to Cambodian development of a new national action plan for health security, aligning with the Asia-Pacific Health Security Action Frameworks. Moreover, identify gap will allow Cambodia to prioritize action for better preparedness using the whole of government and whole of society approach. Protecting health and preparing for future pandemics and health emergency will ensure Cambodia build a resilient health system that is prepared for and able to rapidly respond to public health emergency while maintaining access to essential health services, whatever set the country or the region face in the future. Thank you.
Thank you very much, Dr. Kiri. Thank you very much, Dr. Mariana. Next up, I would like to invite Martin Taylor, WHO representative to China, to share their story.
Good morning. In 2021, the National Health Commission of the People's Republic of China and WHO jointly launched a flagship program piloting people-centered integrated care with strong primary healthcare as the foundation. The goal was to address access and affordability of healthcare and improve quality and responsiveness. This was to better manage the growing burden of non-communicable diseases, care for an aging population, and manage other health challenges. The program is being implemented in 6 counties of different levels of socioeconomic development in 3 Chinese provinces. This represents 4.2 million people. Over the past 3 years, the government, WHO, and partners have designed locally appropriate interventions to reinforce a stronger primary health care and people-centered integrated care at all levels. This resulted in local governments increasing investment in health with special attention to the primary level. Digital tools were developed to assess population health and plan and track interventions. More primary healthcare workers were recruited, remuneration and capacity improved. Importantly, expanded screening, diagnosis and treatment of conditions like hypertension and diabetes improved the non-communicable disease management and control rate. This is a key indicator to measure the progress and performance of people-centered integrated care. It lays a solid foundation for continuous service delivery reform and national scale-up. The pilots strengthened integration between different levels of healthcare provider and used new digital technologies to enable remote consultation and diagnosis. The results of this program have directly contributed to the development of several national policies, including the National Blueprint to build a resilient and people-centered health service delivery system by 2035, which is grounded in primary healthcare. For WHO, this people-centered integrated pilot represents an orchestrated, multi-level, cross-team effort to implement WHO's global and regional vision in China. It promotes integrated ways of working across teams instead of a siloed approach. At a critical juncture of transition towards a mature and developed health system, WHO continues to join hands with Government of China's own efforts to champion health reform and primary healthcare development. This is important for domestic models of primary healthcare that can also have regional applicability. We are now in the process of designing the second phase of this pilot. This will directly contribute to the next phase of China's health reform priorities as championed by the new health minister. And by doing so, will contribute to WHO's global priority of a renewed approach on primary healthcare and our Western Pacific region's focus on transformative primary healthcare. Thank you.
Thank you, Martin. Now it's my pleasure to welcome Dr. Snong Thongsa, the Vice Minister of Health of Lao People's Democratic Republic, to share their story.
Thank you, Mr. Chair. First of all, I would like to appreciate WHO in general, including headquarters and regional, for contribution to the member states so far. While talking about country representative WHO, I would like to appreciate the contribution, the continued contribution of WHO country office in improvement of the Lao health sector. WHO has coordinating all efforts from development partners, technically and financially, to focus on health issue. We see that during the pandemic COVID-19, the big role, the important role of country WHO office in Laos, how hard that we have overcome the situation. Currently, I would like to address on some issue relating to the current situation, addressing the rising the burden of NCD, non-communicable disease in Laos People's Democratic Republic, and building on the country world leading 2021 ban on electronic nicotine delivery system or ENDS, WHO country office supported an area of multi-sector tobacco control efforts with simple aim, saving lives. This focus on strong policy, supporting enforcement, law enforcement, collaboration, and communication for health. Secondly, tackling the health impacts on climate and environmental change in Lao PDR, WHO supported the Ministry of Health and Ministry of Natural Resources and Environment in ensuring 70 health facilities are increasing resilient to worsening climate conditions in extremely weather events via the safe, clean, green, and climate resilient health facility initiative, and support Lao PDR in development of the HNAP, has held a national adaptation plan which to reduce the impact, to reduce the vulnerability. We do the assessment of risk of the health risk to people, vulnerability of healthcare facilities. So again, I would like to appreciate WHO for understanding Lao situation, country office, that we have understanding, working closely together, understanding the situation of the country. Thank you, WHO country representative.
Thank you, Dr. Snong Thongsa. Our next up is Mongolia. Let's welcome Dr. Batur Lagva, Director General, Department of Public Health Policy, Ministry of Health, Mongolia, to share their story. Over to you, sir.
Good morning. Despite the high vaccination coverage for hepatitis B, Mongolia still faces a significant public health challenge due to the widespread prevalence of chronic viral hepatitis B, C, and D. We have conducted population-based screening study. Even the high vaccination rates, a significant portion of the 18 to 30 age group is still suspected of having HPV. This indeed suggests a need to evaluate the effectiveness of the HPV vaccination program. Nearly 1/5 of the adult population is affected by these infections, contributing to the highest liver cancer incidence and mortality rates in the world, where Mongolia ranks first globally for both. Over the past decade, liver cirrhosis and cancer have accounted for 15% of all deaths. with liver cancer representing 44% of all cancer cases. This alarming situation underscores the urgent need for effective intervention. In response, Mongolia launched the Healthy Liver Program in 2017, which offers free viral hepatitis testing and subsidized medications. Despite reaching nearly half the targeted population by 2020, only 40% of diagnosed cases completed antiviral treatment, prompting intensified efforts in the second phase from 2022 to 2025. This phase aims to improve the hepatitis care cascade, expand screening, and introduce treatment for hepatitis D virus, which is estimated to affect 41% to 67% of patients with hepatitis B infection. In 2023, the Ministry of Health enhanced national laboratory capacity and designated bulevirtide HDV treatment as an orphan drug to improve accessibility. The introduction of bulevirtide is essential of effective manage co-infection and reduce the severity of the liver disease among patients. Given the high prevalence of HDV in the country, as of October 2024, 133 patients are enrolled in free bulevirtide monotherapy, with plans for real-life monitoring of its efficacy and safety. WHO has played a crucial role in support Mongolia's hepatitis control efforts, helping establish sentinel surveillance and strengthening health systems since 2016. WHO has also assisted in implementing strategies to eliminate mother-to-child transmission of HIV, hepatitis, and syphilis since 2019. Mongolia remains dedicated to reducing burden of hepatitis and aims to achieve significant progress in hepatitis elimination by 2030 through comprehensive prevention, treatment, and international collaboration. Thank you.
Thank you very much, Dr. Batur. Our next stop is the Philippines, where we will present a video, and then let us welcome the Honorable Secretary of Health of the Philippines to share an update after the video.
Across the Philippines, the health workforce serves as the heartbeat of our nation's healthcare system. From the most remote communities to our urban centers, our dedication and commitment inspires our brand of service, contributing to our collective efforts to ensure equitable access to quality health for all. At the 77th World Health Assembly, the Philippines took a stand, advocating for global strategies to address the pressing challenges faced not just by Filipinos, but by the global health workforce. Our voice was clear. There is an urgent need for strategic investments in human resources for health, with a focus on equitable distribution across sending and receiving countries, skill mix optimization among health occupations, and effective global health workforce planning. Through our collaboration with the WHO, the Philippines has been at the front lines during discussions on human resources for health. From integrating global perspectives on future-proofing health workforce in support of universal healthcare, utilizing the regional HRH framework in the Philippine Health Labor Market Planning, to pioneering the implementation of strategic workforce planning tools such as the workload indicators of staffing need. These interventions help enable us to efficiently allocate resources and ensure that our health services are both effective and equitable. The WHO-supported capacity building programs empower our health workforce. Through targeted training, our health workers are equipped with the skills to meet evolving healthcare challenges. These programs have provided our health workers with the skills and knowledge we need to meet the unique challenges of our communities. Our partnership with the WHO is not just a response to the challenges of today, but a commitment to a future where each Filipino health worker, whether deployed in communities or employed to deliver the characteristic Filipino brand of healthcare overseas, embodies health and enjoys decent working conditions. With the continued support and collaboration of the WHO, and together with the different member states, we shall be able to work together to tackle the critical issues facing our health workforce today. Together, let us forge a path towards health for all.
Distinguished colleagues and fellow leaders in health, I want to extend my gratitude to each one of you for your unwavering commitment to building a sustainable and equitable health workforce. The efforts we've shared here today are not isolated initiatives, but are part of a broader collective movement to strengthen the health workforce across national, regional, and global contexts. The Philippines remains steadfast in its commitment to this cause, knowing that a strong, resilient health workforce is key to achieving universal health coverage and ensuring global health security. Through initiatives like the upcoming launch of the Philippine Pacific Health Initiative in November, our country is exploring actively ways to collaborate with our neighbors in addressing regional workforce challenges, including potential training partnerships, clinical rotations, and systems development to help close the existing gaps. Through WHO support, we have made significant strides in strengthening community-based mental health services to expand access to care and promote mental health awareness across all sectors of society. In 2021, the Philippines was chosen in the Director General's Special Initiative for Mental Health with the goals of establishing sustainable mental health governance and accountability structures, improving access to quality mental health services, and enhancing mental health research and information systems. Over other key efforts assisted by the WHO Philippines include supporting the MH-GAP training for both health and non-health professionals, improving patient navigation and referral systems, piloting brief psychological interventions, building provider capacity in secondary care, developing a mental health information system, and refining M&E processes for both the special initiative and the strategic plan. In response to an increased number of cases of measles and rubella from September 23 to March 2024, particularly in the Bangsamoro region of Muslim Mindanao, the Philippines, with the Secretariat's support, launched a non-selective measles outbreak response immunization, or MORI, targeting children under 10 years old. From April 2024 to May 2024, we successfully vaccinated over 1.2 million children, an 87.9% coverage rate. In addition to vaccination, disease surveillance, active case management, and hospital support were key to controlling the outbreak, minimizing mortality, and preventing future cases by addressing the immunity gaps. Recently, the Philippines successfully secured Emergency Medical Team Verification badges for 3 Philippine Emergency Medical Assistance Teams we call PMAT. The Philippines was also acknowledged as the only country to have 3 Level 1 teams at 1 verification schedule. This PMAT will be part of WHO's registry of internationally deployable teams, which can self-sustain, deliver medical and public health services, as well as operate as an outpatient department within existing health facilities or as a standalone health facility serving temporary health tents during disasters worldwide. We are beyond proud with this achievement of organizing these teams who signify resilience, and dedication in the name of service of the country. We are one with our fellow nations in prioritizing safety and emergency response to crisis as we value each life. The country office served as a co-chair in the country's mechanism for international health partners coordination in support of our 8-point action agenda, including monitoring the evaluation systems on the development partner support. This includes establishment of the M&E strategic planning development of tools and platforms for data analysis and visualization and capacity building. As a proud member of the member state of the WHO, the Philippines recognizes that our shared mission transcends borders. Let us continue to work together, strengthen our partnerships, and move forward towards a future where health for all is not just an aspiration, but a reality. Thank you.
Thanks, Dr. Ted. Next up, I would like to invite the WHO Country Liaison Officer for Tonga, Dr. Anup Gurung, to share their story. Over to you, sir.
A great world leader, Mahatma Gandhi, emphasized the importance of personal responsibility and the power of individual actions in creating a broader social change. He believed the true transformation starts from within, and that each person has the ability to make a significant impact by embodying the values and behaviors they wish to see in society. Allow me to introduce the next video, which describes Tonga's multi-sectoral approach to reduce the NCD burden.
94% of our adult population are overweight or obese. As young as possibly good, we should try and address it. With early onset of obesity, there will also be early onset of NCDs. We can't allow our children to die young because of NCDs. In our culture and our traditions, food is very important to us, but we just need to be more proactive and select healthier, more natural foods. But of course, again, competing is the prices. So you're putting the prices up on the land flaps. What other choices that the people have? Healthier choices needs to be more affordable. The Tonga Health is working together with the Ministry of Health in doing different interventions. In Tonga, we have been leading in the Pacific in introducing policies such as the Syntax for sugary drinks. We work with health promoting schools, health promoting church partnership, and also the health promoting workplaces.
We have to start with the primary level.
In and around Mainima and HPS and Ministry of Education have worked very well, working together with HPS on vegetable gardens, physical activity and nutrition. But the key is collaboration.
We call it education for sustainable development. At the moment, we are developing some of the related policy with the Ministry of Health to support that health promoting schools.
There's an important role of government ministry to work together, introduce the policy. There's a phase of implementation and also the enforcement.
My name is Debalini Palu. I'm 12 years old. My grandfather, he died because he had diabetes. They said he was eating what he wasn't supposed to eat. I want to be a doctor so I can save some of my family's lives.
NCD is not just a health problem. It is a problem for the whole of society. Everyone here in Tonga belongs to a church. People listen to their church leaders. So we've done church interventions.
One way of doing it is reduce the meals, and then instead of a Tongan way of preparing feast, now we move down to a single plate. We have a Zumba program for the church, walking.
It was almost unheard of to have a Zumba class for your youth. As an advocate for physical activity, I am so pleased to see the change of behavior to create an enabling environment for our people.
My message to Tongans is to look after your life because we only have one life and to all the leaders out there to just guide us in the right path.
To address NCD, it is a multi-sectorial approach. It's a whole of a government, it's a whole of a community approach. In fact, this problem will have to be addressed from all aspects, but would need those in governments and those who are in position to make policies and regulations to be also on board, so that we can try and make healthy eating an easy choice.
Thank you, Dr. Anup. Now we travel to our next stop, Vanuatu, where we are joined by the Honorable Minister of Health, John Steele Tariqueta, and the WHO Country Liaison Officer, Dr. Onyong Ko.
Thank you, Madam Chair and Moderator. Like many of our neighbors in the region, we continue to face major barriers to universal health coverage. We must answer the question, what does primary care and universal health coverage look like in practice for the people of Vanuatu? I'm happy to share that we have begun to really answer the question through the following initiatives. Thank you, Madam Chair.
Vanuatu is a country made of 83 beautiful islands. These islands are so diverse, and the majority of
the service delivery, where we're focusing on the integrated outreach services and supportive supervision. And the last pillar is the community empowerment and community engagement. We work very close with the village health worker, the nurses, the health community.
Primary health care, one of the most important things is we need to work together. Yeah.
The primary healthcare demonstration program in Sanu Province really shows the strong collaboration that the ministries can do on the ground in terms of promoting health with our communities. It's truly rewarding to see the successes that this program has made, and it is our hope that this could be replicated to other parts of Vanuatu.
The initial successes have led to further interest and support from other development partners. We are excited for the next stage to scale up and build on the lessons learned from Samar province to other provinces in the country. This has already begun through the review of the Memorandum of Understanding between the Ministry of Health and the Ministry of Internal Affairs to further cement the collaboration across sectors for health for all in Vanuatu.
Thank you very much, Honorable John Steele Tariqueta and Dr. Onyong Ko. Our final stop this morning is Vietnam. Let's welcome our colleague from Vietnam, the Honorable Dr. Lee Thai Ha, Dr. Lee Thai Ha, Deputy Director General, Vietnam Environmental Health Management Agency, and Dr. Angela Pratt, the WHO representative.
Thank you and good morning. Like many you across our region, Vietnam is highly vulnerable to climate change, putting safe healthcare at risk. We have seen this more recently with Typhoon Yagi, which struck the north of Vietnam early in September. For several years, the government of Vietnam has been working with the support of WHO to pilot models for climate resilient and environmentally sustainable healthcare facility. We will use lessons from this process to develop guidelines that we roll out nationally with the aim of scaling up the reach of and impact of this work. The video you are about to see will give you a snapshot for this work.
Ngày xưa nước của bệnh viện chủ yếu dựa vào nguồn nước máy, thì nguồn nước đấy thì nó thường xuyên bị cắt nước ấy, cho nên là sử dụng rất là phải tiết kiệm và nhỏ giọt đấy. Bệnh nhân họ không có để sử dụng các cái nhu cầu cơ bản như đánh răng rửa mặt, tắm rửa, giặt giũ hay là đi vệ sinh ấy, nên họ cũng không muốn ở lại nằm viện ở bệnh viện Nhân Thành ấy.
khảo sát và xây dựng hệ thống dẫn nước thô và cùng với là hệ thống lọc nước để xử lý nước.
Thì có hệ thống mới ấy, với công suất là rất là cao 200 mét khối trên ngày, nhưng mà nó hoạt động rất là tốt, mà tất cả những cái điều đó ấy, thì sẽ giảm nguy cơ lây nhiễm bệnh ở trong bệnh viện, với lại là tăng cái khả năng như kiểu điều trị bệnh và nhanh hồi phục của bệnh nhân.
Thank you very much and good morning, everybody. Very briefly, I had the great pleasure and privilege, as you may have noticed in the video, of visiting that health centre in Yantan just a couple of months ago. And I was very proud to see with my own eyes the difference that relatively small financial investment combined with the guidance of the National Ministry of Health, in particular colleagues like Dr. Ha, who you heard from earlier, as well as some technical support from WHO can make. Quite literally bring a reliable supply of clean water to a healthcare facility which had never had it before. So for the Vietnam Country Office, we're really excited to take the lessons from projects like this one and scale up. Of course, in continued close collaboration with our colleagues at the Ministry of Health, we hope with the financial support of more partners over time to ensure that more people and more communities across Vietnam can benefit from healthcare facilities which are climate resilient, environmentally sustainable, and which of course have a reliable supply of clean water. Thank you very much.
Thanks, Angela and Dr. Lee Tai Ha. Honorable ministers, distinguished delegates, as you can see, we have had another productive year and have accelerated our implementation of the vision. On behalf of the Secretariat, I would like to sincerely thank all of our speakers, as well as our member states and partners who have helped drive the work we heard about in these stories today. I would now like to hand the floor back to Dr. Susie Mercado for some closing remarks.
Thank you very much. They say a picture is worth 1,000 words, but a video with a good story is worth 1,000,000 words. And I think we truly appreciate all immense. But I think what we're seeing here is a long-term perspective and approach to solving problems. And this seems to resonate throughout the region. I think we're also seeing a lot of emphasis on integrating efforts and working with other sectors. In Tonga, we saw work on food, sports, health promoting schools. And I think the Philippines' presentation on health workforce is something that touches all the countries of the Western Pacific. So despite the and how do we sustain, how do we maintain, and how do we expand and scale up the work or accelerate the work? I guess this is what we're trying to do with the new vision. And I would just like to congratulate everyone who participated this year on this. And next year we hope to do more of this and speak about acceleration of the work on the vision. Thank you very much. Madam Chair, may I turn back to you?
Thank you, Dr. Susan Mercado. We will now open for questions and intervention from representatives who wish to speak on this item. Please indicate your wish to speak by clicking the big button on your microphone. Please. So now I call on the representative of Australia to be followed by Kiribati. Yeah, please, Australia.
Thank you. Australia notes the report on WHO's work in countries, and we acknowledge the dedicated work of WHO staff in country offices. WHO staff are key to its ability to deliver its important mandate. Thank you. It is critical that WHO country officers are agile and responsive, with adequate staff and sufficient resources to respond to country needs. We are pleased that WHO has increased its focus on the recruitment and training of representatives, but we remain a bit concerned about the ongoing challenge of attracting, mobilising and retaining high-quality staff in country offices in the Pacific, and we're interested to learn what further action the WHO is undertaking to address this. Australia is keen to work with the region to support the development of a pipeline of qualified staff to fill key positions at the country level. Australia also welcomes future reporting on how organisational reform is being implemented at the country level, including regional plans for addressing the recent MOPAN recommendations related to building higher performance capacity at the country level. We encourage future reporting to include technical outcomes for all country officers in the region. We're also interested in further reporting on the WHO Representative Office for the South Pacific and Division of Pacific Technical Support, and learning more about how the recent audit recommendations are being addressed. To conclude, we'd like to reiterate our thanks and appreciation for the dedication of country office staff, and it's been a pleasure to meet some of you at the RCM this week. Thank you.
Thank you, Australia. Kiribati, please, followed by Papua New Guinea.
Thank you, Madam Chair. Please allow me to initially sidetrack to deliver a few catch-up statements before providing a quick intervention on this agenda item. Regional Director, Honourable Ministers, ladies and gentlemen, Maori and warm greetings, to you all. Firstly, a big apology to my Pacific colleagues for not joining you in making a pledge yesterday, simply due to lack of mandate. This coming Friday, the people of Kiribati will be voting for their next president, which will be followed by the formation of a new cabinet and of course, the nomination of a new Minister for Health. It is a great honor for me to represent my country at this 75th session of the Regional Committee for the Western Pacific region. I'm so privileged to be part of the endorsement of the new health vision for the Western Pacific that was delivered with passion by our Regional Director, Dr. Saya Yukala. There is a saying that vision plus passion plus action will result in exceptional performance. And we saw and heard all of these on day one from our Regional Director. Kiribati is confident that with a great vision, our collective passion, followed by respective actions, we as a region will achieve exceptional performance over the next 5 years. We thank the Secretariat for the good success stories that were shared via video. And capacity for video shooting and editing is something that we're currently working on with our health promotion and communication team. Kiribati wishes to applaud the great work of WHO's Country Liaison Office in Kiribati. In a small country like Kiribati with limited technical capacity in many health fronts, having a WHO office, not just within your country, but right next to your office within the same Ministry of Health compound, has been very helpful for us. We have already witnessed increasing capacity of the CLO office to respond effectively to needed skills and expertise. And we have also witnessed increasing nimble support from the new regional office in Suva. What I mentioned are the two strands or actions for WHO in the new vision. Madam Chair, we appreciate the support WHO has been providing to Kiribati, and we look forward to continued partnership as we continue to weave health for our families, communities, and societies in my country. I thank you.
Thank you, Kiribati. Papua New Guinea, please, followed by Japan.
Chairperson, distinguished delegates and colleagues, Papua New Guinea acknowledges and fully supports the ongoing efforts of WHO under Agenda 15.2, emphasizing the importance of strengthening WHO's work and impact at the country's level. We commend the organization's commitment to addressing emerging health challenges and adapting its support to better align with evolving needs of countries in the Western Pacific region. Our recent launch of the country cooperation strategy between WHO and Papua New Guinea marks a significant milestone in our collective journey towards achieving sustainable health outcomes for our people. The CCS serves as a strategic framework guiding our collaborations over the next 5 years, aligning with both national health outcomes and the global objectives outlined in the WHO 13th General Program of Work and the forthcoming GBW14. The partnership not only strengthens the existing support, but also paves the way for more targeted interventions aimed at transforming our health system. The implementing of the CCS, we are focused on addressing critical health challenges, including the burden of communicable diseases, improving maternal and child health, and bolstering our health system's resilience. We recognize the need for sustainable financing and innovative approaches to overcome funding gaps, as highlighted in the recent regional committee sessions. The country cooperation strategy allows us to prioritize these pressing needs, ensuring that resources are allocated effectively to allow where they will have the most impacts. Papua New Guinea remain committed to working closely with WHO to continuously review and adapt our strategic priorities, reflecting the challenging health landscape and our ambition to attain the Sustainable Development Goals by 2030. We are confident that our ongoing collaboration will continue to deliver meaningful progress in improving the health and well-being of all our people. Thank you.
Thank you, Papua New Guinea. Japan, please, followed by China.
Thank you, Madam Chair. Japan appreciates for preparing the report of WHO's work in countries. Delivering impact at country level is important theme in GPW13, and reflecting country needs is crucial through WHO's cooperation with health ministries and country cooperation strategy. In terms of strengthening impact at country level, we emphasize the importance of evaluation and its utilization to improve WHO's work in countries. Therefore, the implementation of the evaluation plan for 24-25 is crucial, and we expect that the results of each evaluation will be shared in the next regional committee. In order to improve the quality of WHO's activities in the UPLO region and discuss possible areas of improvement, we propose that the next regional committee has a session or agenda item to discuss the evaluation results. Thank you, Madam Chair.
Thank you, Japan. China, please.
谢谢主席女士。今天很高兴的看到各个国家的代表处、世卫组织的国家代表处在各国发挥了非常重要的作用，也感谢西太区办事处越来越重视
And we're appreciative of increasing level of importance given by WIPRO to country offices and liaison offices. We'd like to thank WHO office in China for their work efforts and collaboration. In our national WHO cooperation strategy, we've implemented biannual cooperation programs, including a PCIC program as part and parcel of our health reform packages. And during WHA, China co-hosted integrated PHC side event with some other countries. Once again, our thanks would go to our WIPRO and Regional Director Dr. Sayer and the country office in China for your vigorous support. Our collaboration between China and the WHO has played a big part in working out our Healthy China program and other health initiatives. I'd like to thank the country office of WHO in China for providing a lot of support, and I'd like to thank WHO and WIPRO for your support behind the WHO country office in China. Hopefully, in the process of reform of WHO, we can further strengthen the human resources, staffing, especially technical capacity and core funding of country offices of country presence of WHO. Hopefully, their technical staff will enjoy more funding support so as to improve their technical and global health coordination initiatives while making even greater contribution to their resident countries. Thank you.
Thank you, China. May I now call on the Secretariat to respond to the points that have been made.
Thank you to all member states who provided suggestions during the intervention part of our discussion this morning. First and foremost, we hear you. We really would like to thank the staff inside our country offices who are delivering on the ground and working on the relationship and increasing the partnership between the Ministry of Health and all health stakeholders inside the countries and areas that they're supporting. And we hear you as well. We really need to strengthen ourselves when it comes to attracting, retaining technical expertise into the organization, especially as we move forward in delivering on GPW14 and of course on the Weaving for Health that we have just agreed to in this RC75. We do hear you as well when it comes to the appreciation of our presence in the countries that we are serving. Sometimes it's always nice to know that somebody's looking after you and you can see them face to face and they're with you in the weeds trying to help you out in delivering those very important programs to realize the and achieve the progress that we want to make in the countries. I really appreciate all the countries that have highlighted the importance of the country cooperation strategies. We hear you, PNG, we hear you, China, on trying to implement together the country cooperation strategies. I forgot to thank Cambodia, who recently launched their CCS. Many thanks for trying to really elaborate on the work and the relationship between the country office and the Ministry of Health, and of course the recent signing of the MCCS, the multi-country CCS, which was held this Sunday. It was really nice to see all the Pacific Island countries coming together and working hand in hand with WHO. There was another item on the evaluation plan. I think it's really a good idea knowing what we are monitoring and evaluating as what we are achieving or trying to achieve in country offices, in regional offices, how we want to make that more effective and more efficient. I look into our partners and of course the Secretariat on how we can make your suggestion happen in the upcoming RCMs. I think that's it from my side. Thank you.
Thank you very much. The good news is we are running a little ahead of schedule today. So let's break for coffee now and reconvene in 15 minutes for item 11, the panel discussion on oral health. See you back here promptly at 10:20. Thank you. Welcome back. We will now have a mobility break. May I ask everyone to please stand up and join as WePro Dance Company leads the mobility break. Thank you. We are now moved to agenda item 11, panel discussion on oral health, document WPR/RC55/6. I would like to hand over to the regional director to provide opening remarks. Dr. Pukala, over to you, please.
Thank you, Madam Chair. Distinguished representatives, Madam Chair, I think we need this mobility break more often. Keep us awakened, re-energize us before we start. But welcome to today's site event on oral health, and I'm pleased to introduce for your consideration the document in front of you, WPR/RC75/6 on oral health in the Western Pacific region. As you all know, that oral diseases are a significant health burden across our region. More than 2 out of every 5 people, or even more than 800 million in our region, are affected by oral diseases.
And the four major oral diseases, the dental caries, periodontal diseases, tooth loss, and oral cancer, disproportionately impact vulnerable populations, further exacerbating health inequities. But the good news is that most major oral diseases are preventable through oral hygiene measures, such as using fluoride-containing toothpaste and controlling the NCD risk factors. You all know about the NCD risk factors. Oral health is an important element of the region's new vision. This builds on several World Health Assembly actions in recent years, culminating in the adoption and release earlier this year of the Global Oral Health Action Plan 2023-2030. And the action plan reaffirms member state commitments on 3 priorities to advance oral health. The first priority is governance and research, particularly developing national oral health policies and strategies. Second is lifelong oral health promotion and prevention of oral disease through engagement with families, communities, schools, and all of society. And the third is the integration of oral health into primary health care. So I invite member states to review this item and share your perspective during this panel discussion to strengthen collaboration and commitments to improve oral health outcomes for all. I think I may remember that the last time the oral health has been discussed was 30 plus years ago. And as I said, oral health is one of the priorities of our new vision. We cannot talk about good nutrition without better oral health care. With that, I would like to introduce to you our moderator for today's panel discussion, Dr. Posikai Samuel Tapo, the Acting Director General, Ministry of Health, Vanuatu, my good friend. And it's just fitting for this session to be moderated by a dental surgeon. Can we all put our hands together and welcome the moderator?
Thank you, RD. Good morning, Excellencies. Thank you, RD, for the kind introduction. My name, as the RD has mentioned, is Dr. Posikai Samuel Tapo. I'm the Acting Director General for the Vanuatu Ministry of Health. And as he has mentioned, I'm a dental surgeon. After 38 years plus, this subject has now been listed as an agenda, and I'm so privileged to be part of history as we discuss this important agenda. I am honored and to serve as the moderator for today's important panel discussion on oral health. And we are privileged today to be joined by esteemed leaders in public health who will share their insights on how to strengthen oral health governance, engage community for lifetime oral health, and integrate essential oral health services into primary health care. Honorable Excellencies, now we will watch a brief video that highlights snapshots of oral health. This video provides an important perspective on oral health challenges individuals face. Thank you for the powerful visual summary illustrating the impacts of oral health across the life course. Excellency and distinguished guests, next we will have a presentation from Dr. Guy Furness, the Acting Director of the Department of Non-Communicable Diseases, Rehabilitation and Disability at the WHO headquarters. This presentation will delve into global and regional oral health situations and Global Oral Health Action Plan 2023 to 2030 and its strategic objectives to guide our efforts.
Thank you, esteemed member state representatives, regional director, dear colleagues. Thank you for this important invitation to present WHO's perspective on achieving universal health coverage for oral health during the oral health panel discussion at your 75th Regional Committee meeting. First, I would like to congratulate member states of the Western Pacific region for prioritizing to discuss oral health at the Regional Committee. This year, oral health has been neglected on the global health agenda, but there has been a growing momentum globally in recent years. I am very pleased to see and accompany this momentum and see that it is now reflected at regional level. I would like to begin with alarming findings from our recent WHO Global Oral Health Report, published in 2022. This report provides, for the first time ever, a global overview of oral diseases, revealing that they are the most prevalent non-communicable diseases worldwide, affecting 3.5 billion people. That's half of the global population. It's important to note that the number of oral disease cases exceeds the combined cases of all other non-communicable diseases. The alarming burden of oral diseases is also evident in your region, Western Pacific region, where oral diseases affect 800 million people, or 42% of the population. Compared with other WHO regions, this is one of the highest number of cases, reflecting the region's large population. Despite efforts to improve oral health in the region, the number of cases has significantly increased over the past 30 years, since 1990, rising by 180 million cases. This underscores the urgent need to address the burden of oral diseases as part of the NCD agenda, and very much requested by member states. The challenge we face is not only the burden of oral disease. There is also a significant barrier to delivering essential oral health services to those in need in most of the countries in the region. One major challenge is the accessibility and affordability of essential oral health care. Although cost-effective interventions exist, oral health services are often not part of the national UHC benefit packages, resulting in high out-of-pocket expenses for families and communities. In addition, the dentist-centered workforce model currently applied in most of countries and the lack of integration of oral health care into primary health care facilities makes it difficult for people to access the care they need at an affordable cost. Reflecting those challenges, we at WHO have recently have exciting and promising news on the global momentum towards oral health. This momentum began with the adoption of the landmark resolution on oral health by the World Health Assembly in 2021. This resolution was supported by many member states in the Western Pacific region very actively. This resolution requested the oral health should be embedded into the NCD and UHC agendas, and as our WHO Director General, Dr. Tedros, well stated, this resolution is a game changer and it opens a promising window of opportunity to address the burden of oral disease towards achieving UHC for oral health. Based on that mandate given to WHO Secretariat, a global strategy on oral health was subsequently developed and adopted the following year at the World Health Assembly in 2022, and then translated into a practical global oral health action plan the following year in 2023. So we have been very active in building on that momentum that you have created for us. Following that resolution, we now have a strong set of policy documents on oral health. The overarching vision of this global policy is UHC for oral health for all by 2030 through a primary healthcare approach. The strategy includes 11 global targets to be achieved by 2030 across 6 strategic objectives. Additionally, there are 100 actions outlined for member states, the WHO Secretariat, international partners, civil society organizations, and the private sector. The Global Oral Health Action Plan 2023-2030 outlines these 6 important and strategic objectives to improve oral health worldwide. I'd like to land on a bit of detail on each to understand the very extensive work WHO has already triggered in supporting our member states address these 5 objectives. 6 objectives. Oral health governance, the first. Strengthening leadership and governance for oral health at all levels. Oral health promotion and disease prevention, enhancing efforts to promote oral health and prevent oral diseases. Health workforce, building a competent, sustainable, and innovative health workforce to respond to the needs of the population on oral health. Oral health care, ensuring access to comprehensive, person-centered oral health care. Oral health information systems, improving data collection, surveillance, and use for informed decision-making. And oral health research agendas, advancing research to address population-based gaps in innovation in oral health. This document will guide member states in making tangible progress towards improving oral health. Finally, I am also pleased to highlight that oral health is clearly recognized as one of the outcome indicators in WHO's 14th General Program of Work, known as GPW14, making oral health a priority for WHO in its support to member states over the 4-year period of 2025 to 2028. I would like to conclude my presentation with an exciting upcoming transformative milestone event, the 4th UN General Assembly High-Level Meeting on NCDs in 2025, which aims to define and shape that transformative future for the global NCD agenda, supporting our member states ultimately address NCD prevention and control and health and well-being, not only into 2030, but beyond, into the following decades, 2050 and beyond. WHO has organized several key high-level meetings to contribute to this event. For example, we have held several meetings related to Small Island Developing States, SIDS, and we appreciate the active engagement, lessons learned, and key success stories from the Pacific Island countries in this context. As part of these high key-level events, WHO will organize the first ever Global Oral Health Meeting this November in Thailand. The overall objectives of this meeting are first and foremost reaffirm the political commitment by member states based on the 2021 resolution on oral health. Second, accelerating and scaling up national efforts to prevent and control NCDs with a focus on oral disease to achieve UHC by 2030. And third, contributing to the preparatory process leading to the 4th high-level meeting on NCDs in 2025. I am also delighted to understand that the Regional Director, Dr. Saya Maupuikala, will join this important meeting in person at the high-level segment of the WHO Global Oral Health Meeting, where we invite additional health ministers from several champion countries on oral health. WHO is inviting all 194 member states to participate in this important meeting, specifically inviting 2 colleagues from Ministries of Health, the National Oral Health Lead and the National UHC Lead. We hope to see many countries in Thailand to accelerate the implementation of the Global Oral Health Action Plan at the regional and country levels. And with that, I thank you very much. And as Dr. Tedros recently said, there is no health without oral health. I wish you a fruitful and productive discussion on oral health. Thank you so much for your attention.
Thank you, Dr. Fornes, for this comprehensive overview and for outlining the Global Oral Health Action Plan 2023 to 2030. Now we will move into the panel discussions. As outlined in Dr. Piukala's opening remarks, the key regional priorities for oral health includes strengthening oral health governance and research, promoting community engagement for lifetime oral health, and integrating oral health services into primary health care as part of the universal health coverage. To discuss these priorities in more details, we are joined by distinguished panelists who will share their experience. To discuss the strengthening of oral health governance and research, I will be sharing insights from Vanuatu, where we have recently revised our national oral health policy to align with the Global Oral Health Action Plan. Next, to highlight efforts in promoting community engagement for oral health, we will welcome Dr. Cecilia Fifita, the Chief Dental Officer for the Ministry of Health in Tonga, who will share Tonga's Mali Mali program, which promotes oral health across all generations, particularly through schools and communities. Finally, to address integration for oral health services into primary health care under the universal health coverage, we invite Dr. Nomi Binti Otman, the Deputy Director General of Health, Ministry of Health from Malaysia, who will discuss Malaysia's work in ensuring accessible oral health services in the broader health systems. Distinguished guests from Vanuatu, I would like to share the efforts on the revision of the National Oral Health Policy and the strategic plan. Vanuatu has consistently prioritized the health and well-being of its citizens, particularly in oral health. Our efforts began with the National Oral Health Survey in 2017, which reveals the key challenges, including 70% prevalence of dental caries and 78% prevalence of periodontal diseases, both driven by high sugar consumption and poor oral hygiene practices. These findings have led to the development of our first national oral policy for 2019 to 2023. This policy, we focused on improving access, expanding infrastructures, and promoting prevention through programs like Good Flood Tooth Program, especially in schools, which introduced supervised toothbrushing for our children. In August of 2023, we initiated a comprehensive review of the 2019 to 2023 policy to assess its program and also to identify areas for improvement. This vigorous process involved collaboration with multi-sectoral stakeholders, including representatives from various departments within the Ministry of Health and other ministries in government, such as Ministry of Education, Environment, as well as non-government organizations. The review of our National Oral Health Policy for 2019 and 2023 highlighted several challenges, which I will share: persistent gaps in workforce, capacity and access, especially in rural areas, limitations in data and monitoring systems that hinder effective decision-making, and the need to integrate oral health more effectively with NCD programs to address common risk factors like tobacco and sugar consumptions. Building on the insights from the review, we are now in the process of finalizing our National Oral Health Policy and Strategic Action Plan for 2024 to 2030. The draft policy focuses on several key areas. First is to improve access to care across all our 6 provinces through the Provincial Dental Services Plans, strengthening prevention efforts by expanding the Goodfella Smile Nest program, which continues to address early childhood caries through supervised toothbrushing, especially in schools, aligning oral health with broader health initiatives, such as the NCD Strategic Action Plan for 2021 to 2030 to tackle shared risk factors, and finally, enhancing governance and monitoring systems to ensure continuous improvements and accountability. It is a collaborative effort, uniting key government stakeholders in different ministries, such as education, environment, human resources, to align revised policy with the shared vision and integrate it with the public health initiatives. Though still underdeveloped, the revised policy aims to align with Global Oral Health Action Plan for 2023 and 2030, and also promote sustainable progress towards universal health coverage by embedding oral health within primary health care initiatives. In summary, Excellencies, the National Oral Health Policy and Strategic Plan 2024-2023 will offer a strategic path to improve oral health outcomes and ensure equitable access to care for all our citizens. With its emphasis on prevention, governance, and alignment with other programs, Vanuatu's policy revision process demonstrates the importance of robust government. We aim to strengthen monitoring systems, foster accountability, and engage multi-sectoral stakeholders to build more resilient oral health systems. Through these governance efforts, we are committed to ensure sustainability and continuous improvement over time. Excellencies and distinguished guests, now let me invite our second panelist, Dr. Cecilia Fifita, who will tell us about Tonga's experience in the implementation of the second regional priority, and that is to engage families, communities, schools, and society in oral health initiatives to prevent oral diseases and promote lifelong oral health. Dr. Cecilia.
Malloy Lele, Madam Chair, Regional Director for Western Pacific, Honorable Delegates, panel moderator, ladies and gentlemen. In the Kingdom of Tonga, oral health promotion and disease prevention have long been a priority. I'm honored to share the successes of our Mari Mari program, a pioneering school-based oral health initiative launched in 1998. Tonga, home to approximately 100,000 people, has seen significant rise in oral diseases like dental caries and periodontitis since the 1970s. By 1998, many children were suffering from severe dental caries due to a shift in dietary habits, particularly an increase in sugar-rich foods and bread. This dietary shift, coupled with limited access to oral hygiene products like toothbrushes and toothpaste, led to an increase in dental diseases, worsening product and health issues such as obesity, diabetes, and heart disease. Oral healthcare services face challenges, including geographical barriers across 6 main islands and over 170 smaller islands, limited facilities, and inadequate equipment. Recognizing the need for prevention and education, the Mari Mari program was launched in 1998 to improve children's oral health through school-based preventive measures and promote lifelong oral hygiene practices. The Mari Mari program, meaning SMILE in Tongan, is a comprehensive oral health initiative focused on improving oral hygiene across Tonga, particularly in schools. The program evolved in response to community needs, expanding its reach over time. The program's team visits schools weekly, training teachers and students on proper oral hygiene practices, including brushing teeth and using fluoride mouth rinsing. From 1998 to 2009, it expanded to kindergartens and primary schools, conducting workshops for dental professional educators and families. Between 2009 to 2012, new educational materials were introduced, and by 2013, the program began including adults, focusing on managing non-communicable disease and supporting people with disabilities. The program's success is driven by collaboration between the Ministry of Health, Ministry of Education, voluntary Japanese dentists from the South Pacific Medical Team, Japan, Rotary team from West Ballarat, Australia, JICA for 6 years, DFAT, WHO and private sectors. In addition, standardized materials like the textbook of oral health ensure consistent messaging in schools, while public awareness campaigns via TV, radio, and government websites have helped spread the importance of oral hygiene. These efforts have fostered a nationwide culture of oral health awareness. The Mari Mari program has seen remarkable success. Enrollment surged from 0.3% in 1999 to 99% by 2011, and caries rate dropped from 90% in 2001 to 68% by 2011. Nearly all primary schools were participating by 2011, and the program has now been fully integrated into schools' curriculums. Managed by Tongan staff, it remains sustainable and continues to support children's oral health. Since 2012, the program has shifted to different levels, expanding to include adults, addressing the oral health needs of the entire population. The program now involves high schools, disabled centers, home visits, and oral health assessment for diabetics. It has also extended its services to outer island schools and adults, ensuring a more comprehensive community-wide approach. In summary, the Mari Mari program has grown from a school-based initiative to a nationwide effort promoting lifelong oral health and improving overall health outcomes in Tonga. By engaging families, communities, and schools, it supports Tonga's alignment with the second regional priority of the Global Oral Health Action Plan 2023 to 2030. Thank you. Malo Aupito.
Thank you, Dr. Cecilia and our colleagues from Tonga for sharing the Mali Mali experience. It's a pleasure to learn about the excellent initiatives in Tonga, especially the community engagement in oral health promotions. Dr. Celia, we were impressed by the remarkable achievement, including the increased coverage and reduced dental caries in children. Our question will be, what challenges did you encounter in implementing the program, and how were they overcome? Thank you.
The Mari Mari program has successfully improved the dental health of Tongan children for over the past 2 decades, but the challenges remain. One major issue is the isolations of many outer islands, making it difficult to provide preventive care, raising awareness, and transport supplies. Reaching to these remote areas requires time and efforts. Another challenge is inconsistent funding. In some years, the program has enough money for essential items like toothbrushes and toothpaste. In linear years, however, we rely on support from teachers, PTA, and donors to continue. Ensuring that all islands receive the necessary resources is an ongoing struggle. The program works hard to distribute supplies fairly, but limited funds make it difficult to reach every area equally. For the program to run daily, we need vehicles in the 6 main islands, and we seek the assistance of the Ministry of Health and the voluntary team, South Pacific Medical Team from Japan. Despite these challenges, Mari Mari program has found ways to overcome them through strong community involvement and partnerships. Teachers and the PDAs help sustain the program during tight budget years by fundraising and raising awareness. Partnership with various stakeholders provide additional support, ensuring the program has the necessary supplies. To reach remote islands, the program, we train the local health workers, the dental assistants, dental therapists, and teachers, enabling them to deliver oral health care and education directly to their communities. These efforts have helped the program continue making a positive impact despite the challenges. Thank you, Malo Albito.
Thank you, Dr. Cecilia, and I'm so privileged to sit next to the Tonga Minister of Health. So he has taken this into consideration, especially the funding and the supplies. Thank you, my good honorable Minister. We look forward to learning more about further progress on the Malimali program in Tonga. Excellencies, distinguished guests, we will now move to our next presenter. We now turn to the different part of the region. Malaysia, a country that has successfully integrated oral health with primary health care. Over to you, Dr. Nomi Binti Othman. Thank you.
Thank you, Madam Chair. First and foremost, I would like to express my sincere appreciation for the opportunity to be part of this critical panel discussion on oral health. I would like to extend my gratitude to the World Health Organizations and the member states, especially Dr. Saya Mau Piu Kala, Regional Director, for their unwavering commitment to advancing oral health within the broader context of universal health coverage in the Western Pacific region and globally. So as we discuss the integration of oral health in primary healthcare, I would like to share Malaysia's experience. Our national oral health policy emphasizes a holistic approach to health, recognizing that oral health is integral to overall well-being. We have adopted the health in all policy approach, ensuring that oral health is not seen in isolation, but is embedded in general health policy and programs. A key aspect of this integration is the newly established governance structure within the Ministry of Health of Primary Care, which allow for better coordination and cooperation among all healthcare providers. This ensures that oral health services are fully integrated into a broader primary healthcare approach framework, promoting both efficiency and accessibility. Next, Malaysia's strategy for integrating oral health services into primary healthcare relies heavily on collaboration between dental and medical professionals. For instance, through the Enhanced Primary Healthcare Program, we aim to address non-communicable diseases holistically by enhancing primary healthcare services and facilitating cross-referral between oral health and medical services. For example, referrals of type 2 diabetes mellitus patient to oral health to see their periodontal problem. And at the same time, we also have community nurses who visited the first mother to take care of their newborn child by teaching how to clean the oral cavity after every feeding. So our services are designed to cover the full life course from childhood to old age, ensuring a comprehensive approach to prevention, care, and rehabilitation. These services are provided at affordable charges. For example, a simple filling or scaling costs just 40 cents USD, while both upper and lower dentures fee is 21 USD, making them accessible to all segments of society and forming a crucial part of our universal health coverage efforts. Next, One of the major challenges we face is a shortage of trained oral health professionals. To address this, Malaysia has introduced several workforce development initiatives. We have increased the number of trained health volunteers called My Champion and Dental Icon, who are involved in the promoting of general health and oral health, particularly in underserved community. We also train a medical orderly who works in prison to assist dental practitioners who provide care in prison to tackle shortage of dental surgery assistants. Next, additionally, we collaborate with various stakeholders, including private practitioners, universities, dental armed forces, and industrial players to extend our outreach. For example, the screening of toddlers in private kindergarten, enabling an early detection of oral diseases. This partnership approach complements the efforts of the Ministry of Health Malaysia in expanding service coverage. Next, I would like to also highlight our effort to strengthen health information system in Malaysia, developing an integrated health information system that includes oral health data such as our dental information system and geographical information system. These tools will enable more precise monitoring and planning, ultimately leading to improved service delivery and outcome. In conclusion, the integration of oral health into primary healthcare, workforce development, and robust health information system are vital components in our journey towards achieving universal health coverage. We are committed to continue collaborating and sharing of best practices to improve oral health outcome for all. Thank you.
Thank you, Dr. Nomi, and our colleagues from Malaysia for the excellent initiative in integrating oral health with primary health care under UHC. Now, I would like to ask a question to Dr. Nomi. Would you tell us more about the challenges encountered in improving workforce availability and health information systems in Malaysia? Thank you.
Okay. In implementing our oral health initiatives, several key challenges have emerged. Firstly, geographical disparity, particularly in rural and remote areas such as Sabah and Sarawak states, continue to impede access to both primary oral health care. Transportation difficulties are a significant barrier for patients seeking care. While approximately 60% of Ministry of Health facilities are equipped with dental services, the integration of oral health into primary healthcare requires further training of primary healthcare providers, including doctors and nurses, in recognizing and managing basic oral health conditions. Currently, such training is limited, which affects the overall effectiveness of the integration. Additionally, there is a shortage of oral health workforce, particularly dental surgery assistant, which constrain our ability to meet demand. This is compounded by challenges in IT infrastructure. Although we have a web-based dental information system that can access via mobile devices, a fully integrated electronic medical record system is still lacking or considered work in progress. In terms of dental supplies, we have promoted bulk purchasing and expanded the list of available materials. However, the regulatory separation between drug list and cosmetic products such as fluoride toothpaste remains an issue. Addressing these challenges is critical to advancing our oral health initiative. Thank you.
Thank you, Dr. Nomi. We hope to learn more in future from the excellent initiatives in Malaysia on oral health. So we have heard from rich experience in the respective priorities from the three countries. Now I would like to ask the two panelists, including myself, looking ahead, how will our countries or your country ensure the long-term sustainability of efforts while addressing also the challenges? I will go first. Looking ahead, especially for Vanuatu. Vanuatu is committed to ensuring, through the support of the Honorable Minister, the sustainability of our oral health efforts through strong governance and effective policy implementation, the revision of the National Oral Health Policy and Strategy, Action Plan for 2024 and 2030 to 2030 will help us in strengthening monitoring and evaluation frameworks and ensuring accountability, especially in data-driven decisions. We will also focus on addressing challenges like workforce, and that's the similar challenge that is faced by the two other countries as well. Workforce shortages and access to care in rural areas. Considering 80% of our population live in rural remote areas, we plan to expand outreach programs to engage village healthcare workers, so some countries they call them community health workers, to deliver essential oral health services, integrating oral health into primary health care, which our colleague from Malaysia has presented in terms of how they have integrated it. Vanuatu is also looking in that direction to ensure it becomes part of our routine services available to all our citizens as part of the Ministry of Health's integrated approach. We are also in 2025, which is next year, hosting the Oral Health Pacific Alliance, which I invite everyone to also be part of it, to provide a great opportunity to reaffirm our commitment to oral health and strengthening regional partnership through collaboration with other Pacific Island countries, and we can share experiences as well, learn from each other, and tackle common challenges together. With these efforts, we aim to build a more resilient and sustainable oral health system for the future in Vanuatu. Now I will give the opportunity to Dr. Cecilia to say a few words. Thank you.
Thank you. Tonga is building on the success of the Mali Mali program to ensure long-term sustainability and expand its impact on overall health. We are focusing on key priorities, for example, like strengthening community ownership is essential. By empowering schools, PTAs, and local leaders, communities will take a more active role in the program, ensuring its continued growth and integration into broader health initiatives, even with limited resources. In addition, building the capacity of local health workers is crucial. Training local health workers and teachers will help deliver both oral and general health services to all communities, especially remote areas, reducing reliance on external resources and strengthening the local health system. Lastly, securing stable funding is critical for the program's sustainability. We will work with partners to secure long-term funding. We have many donors and partners. We are really in good terms in Tonga. And at the same time, we explore multiple resources such as local fundraising and community contribution. With this, we aim to create a more resilient foundation that ensures the program's continued success. By fostering community engagement, building local capacity, and securing partnership, Tonga will ensure the Mali Mali program continues to improve both oral health and overall well-being for future generations. Thank you. Malo Aupito.
Thank you, Dr. Cecilia. We'll give the floor to Dr. Nomi. Thank you.
Thank you. Looking ahead, Malaysia is committed to addressing the challenges we face while ensuring a long-term sustainability of our oral health effort. To To overcome geographical disparity, we are working with various stakeholders to complement each other in outreach services and utilizing geographical information system mapping to identify underserved areas. Additionally, we are negotiating to expand oral healthcare services in rural clinics, ensuring equitable access. We are also focusing on interprofessional collaboration and training to better integrate oral health into primary healthcare. The Medical Madani scheme, which involves strategic purchaser and multidisciplinary approaches, is one of such initiatives. Recently, we co-organized the Cleft Lip and Palate Conference 2024, which emphasized strengthening interdisciplinary collaboration in managing cleft condition. We aim to enhance primary care services to better address non-communicable disease through a common risk factor approach. To address the shortage of dental surgery assistants, we are planning to increase the intake of dental surgery assistant training and to open another training center in each Malaysia. Furthermore, negotiations are underway to secure more IT resources to sustain our web-based dental information system and to engage stakeholders in expanding the essential dental leads to include dental preparations. All these efforts will ensure our initiatives remain sustainable for a long term. Thank you.
Thank you, Dr. Cecilia and Dr. Nomi, for being part of our panelists this morning, for sharing the valuable experiences and perspectives. Now, through the Honorable Chair, we will open the floor for interventions from member states. Please share your reflection on actions on strengthening oral health in your countries by indicating if you could like to speak, and I will call on you in your turn. Thank you. I now call upon China. Thank you.
谢谢主席。中方注意到，口腔疾病是本区域内最常见的非传染性疾病。也注意到，本区域在实现口腔卫生全面覆盖方面仍面临挑战。结合会议文件中提出的实施口腔卫生倡议的3类行动，中方愿分享以下3方面做法。第一，在口腔健康治理和研究方面，中国政府制定了健康口腔行动方案2019到2025年，设置国家口腔医学中心和医疗质量控制中心，促进口腔医学领域建设与发展，
which serve to promote the development of stomatology as a specialized field, improve healthcare services and enhance research capabilities. Second, in terms of family, community and social engagement, China has launched extensive nationwide initiatives to address children's oral disease, both at home and in schools, providing oral health education program, free dental examinations, dental sealants and topical fluoride treatments. Leveraging such occasions as the World Oral Health Day and China's National Dental Care Day, we've actively rolled out oral health education campaigns to continuously raise public awareness and skills in oral health care. Third, when it comes to integrating oral health into primary health care, China has launched a nationwide program to monitor the oral health of key populations. We have also extended the delivery of oral health services through the training of oral health professionals at primary level.
China will host the FDI World Dental Congress again in 2025. We welcome the attendance of our WIPRO members. Committed to promoting international exchanges and cooperating in oral health, we are willing to join forces with international organizations such as the WHO, related countries and regions in developing all-round and multi-level collaborations and contribute China's share to global oral health. Looking ahead, we face serious health challenges. It is hoped that the WHO will continue prioritizing oral health in developing countries by sharing the advanced experiences in prevention control, new diagnostic and therapeutics, and cutting-edge research results and innovations. China stands ready to work with all parties to achieve our common goal of oral health for all. Thank you, Madam Chair.
I now call upon the distinguished delegate for Hong Kong, China, followed by the Republic of Korea.
Thank you. Madam Chair, honorable ministers, distinguished delegates, ladies and gentlemen. Hong Kong, China would like to express our appreciation for the excellent effort of the Western Pacific Regional Office in promoting oral health. The government of Hong Kong, China recognizes that it is most cost-effective to put the emphasis on preventive dental services to enhance the overall level of citizens' oral health. All along, the government has adopted a life course approach and focused on increasing the public's awareness on oral health and their proper use of oral health services. The government also provides or subsidizes dental services for the vulnerable populations. For example, outreach services are provided to the elderly receiving long-term care services, and free emergency dental service is provided to persons with financial difficulties. The Department of Health has been implementing a school dental care service for over 40 years to provide annual dental checkup services to primary school students and students with physical or intellectual disabilities in special schools until age 18. In the past 20 years, the dental caries rates among 12-year-old children in Hong Kong, China has been among the lowest globally. By the end of 2022, the government established a working group on oral health and dental care to conduct a comprehensive review of the public dental services provided or subsidized by the government. In December 2023, the working group released an interim report to recommend the government to work with the goal of retention of natural teeth and enhancing the overall level of citizens' oral health by development of primary dental services for different age groups and underprivileged. In order to encourage early dental checkups from a younger age, we are going to launch a new program for preschool children in year 2025 by integration of oral health assessment into primary healthcare facilities for infants and children, such as the maternal and child health centers. Furthermore, we will implement a primary dental co-care pilot scheme for adolescents to promote their lifelong habit of regular dental checkups for the prevention of dental diseases, and a community dental support program targeting underprivileged groups with financial difficulties. We will continue to conduct regular oral health promotion programs and campaigns to promote low-cost dental checkup habits and healthy lifestyles conducive to good oral health. The government of Hong Kong, China supports WHO strategies in dental disease prevention and will be pleased to share our experience with member states. Thank you.
Distinguished delegate, the Republic of Korea.
Thank you, Madam Chair, and distinguished panelists. The Korean government supports the Global Oral Health Action Plan 2023-2030 and its implementation guidance on the regional level. Achieving the highest attainable standard of oral health is every person's basic right, and the global strategy on oral health and the Global Oral Health Action Plan 2023-2030 are based on achieving health-related SDGs and UHC. These are in line with WHO's JPW13. Mostly, the conventional dentist-centered oral health services are not very accessible because of its high cost. Risk factors for oral diseases are consumption of sugar, cigarettes, and alcohol, as they are also risk factor for other chronic illnesses. It will be desirable that oral health becomes part of a comprehensive approach. In particular, we believe it is desirable to make sure communities are at the center and to establish a strategy centering around preventive intervention provided in a customized way by stage of life cycle. In order to guarantee oral health efficiently with limited medical resources. Considering this context, the Korean government regularly establishes basic plan for oral health projects and has expanded the coverage from national health insurance for oral health required throughout the life cycle by managing oral health of young children and supporting adults' preventive scaling services and senior citizens' dentures and implants. To conclude, Korea will continue to cooperate in developing the implementation guidance for our member states in the Western Pacific region and implementing the framework by sharing our experience and others. Thank you.
We now give the floor to the distinguished delegate for Fiji, followed by Brunei Darussalam.
Thank you, panel moderator, distinguished panelists, honorable members of the forum. Fiji acknowledges the inclusion of this agenda item in this year's RCM and thanks the insight and learning shared by the panelists today. Oral health diseases remain prevalent in Fiji and continues to require significant effort and investment to address. The WHO's Oral Health Country Profile 2022 reported that the prevalence of untreated caries of deciduous teeth in children aged 1 to 9 years was 46.7%, while the prevalence of untreated caries in permanent teeth was 35.2% for those aged 5 years and over. The report also stated that the total expenditure on dental health care in Fiji in 2019 was estimated at $6.9 million. In response, the government has raised domestic tax on sugary and sweetened beverages since 2013 to 40 cents per liter or kilogram on juice, ice cream, sweet biscuit, snacks, and sugar confectionaries to reduce the consumption of these foods that contribute to oral disease and increase the risk of NCDs. Fiji will continue to pursue these population-based interventions for oral health and NCDs. The Ministry of Health and Medical Services has worked closely with its stakeholders in the private sector through the engagement in the annual Oral Health Week to raise awareness on personal oral health, hygiene and care, daily toothbrushing and flossing, and eating healthy food to prevent oral diseases and promote lifelong oral health and well-being. The Ministry is also committed to undertake the National Oral Health Survey in the coming 12 months to assess the status of oral health and well-being, and will seek the support of WHO and partners to undertake this exercise. The report of the survey will guide Fiji's further strategies on oral health care and well-being. In 2014, responding to the stated needs of the Pacific, the Fiji National University commenced a postgraduate diploma and master's course in oral surgery. To date, the program has graduated 16 oral surgeons for the Solomon Islands, Vanuatu, Samoa, Kiribati, Tonga, American Samoa, Nauru, Marshall Islands, Cook Islands, and Fiji. And these surgeons are doing an amazing job in attending to complex oral surgical cases, including oral cancer, in their own countries, increasing access to specialized oral surgical care in their respective communities, and reducing the cost of healthcare in their countries by reducing the need for overseas referral for such cases, as used to happen in the past. Fiji invites the support of WHO and our partners towards our oral health programs, capacity building, governance and research to improve oral health and NCD for Fiji and the region. I thank you, Chair.
The distinguished delegate for Brunei Darussalam. Thank you.
Distinguished guests, Excellencies and distinguished guests, good morning. Oral diseases remain a significant challenge in Brunei. Improving oral health is crucial for overall well-being. In Brunei Darussalam, several initiatives and programs have been implemented to enhance health awareness and access to care. Firstly, since in 1980s, dental clinics have been integrated into health centers and hospitals to incorporate oral health care as part of universal health care, which is accessible to every community group. One of our oral health programs, which started in 2011, specifically focuses on promoting good oral health care among children from an early age with involvement of parents or carers. Our service also includes providing dental screening and necessary dental care to patients before and after treatment procedures, such as cardiac surgery, radiotherapy, kidney transplant, and biphosphonate therapy, ensuring optimum oral health outcomes. Unfortunately, our service has been unable to accommodate the screening of the large number of diabetic patients due to a shortage of manpower. However, we are committed to ensure oral health care services are accessible to everyone by deploying a traveling team to remote areas and prisons, as well as bringing community programs to welfare homes and elderly institutions. Our latest initiative is to bring dental screening, preventive care, and oral health education directly to the homes of special needs patients with limited mobility or bedbound by engaging the family members in promoting good oral health care. Secondly, we strengthen our collaboration with various stakeholders for successful oral health programs. After COVID-19 pandemic, school dental services have gradually reopened to provide preventive care, dental treatment, and various activities to inculcate healthy oral habit among school children. We are also expanding our effort by incorporating the oral health education into the school curriculum. We collaborate closely with local and international institutions in training programs to address the shortage of oral health workforce. One of the measures to reduce sugar intake, Brunei has introduced an excise tax on sugar-sweetened beverages in 2017. Despite our efforts to regulate high sugar food and beverages sold in school, we encounter challenges in monitoring these restrictions. Brunei has achieved almost 100% population access to water fluoridation. We plan to work in partnership with relevant stakeholders to monitor fluoride level in water and to analyze fluoride content in toothpaste and provide a seal of approval logo on toothpaste as part of our efforts to educate public and promote the use of toothpaste containing recommended level of fluoride. Finally, our next plan is to conduct the National Oral Health Survey, and we look forward to receiving a support and guidance from the World Health Organization. Thank you very much.
Thank you. We will have the distinguished delegate for Cambodia, followed by Cook Islands.
Honorable Chair, Excellency, ladies and gentlemen, Cambodia has tried hard to bring public oral health program to meet population needs, while its intervention in public health care cover countrywide. The distribution of the oral health workforce is not yet optimal, and there is a gap between existing oral health workforce, the existing service structure, and the oral health needs of the people. Early childhood and dental care is among primary school children, emerging needs of older adults within the population, cancerous, precancerous, oral musical lesion are main causes in the field of oral health intervention in the countries. In response to this challenge, Cambodia adopted National Action Plan for Oral Health 2023-2030. The National Action Plan on School Health 2021-2030 has guided oral health care services to students in pre and primary school. The attainment oral health universal coverage among children below 6 years old, Ministry of Health plan to increase practice of group daily toothbrushing in primary school, conduct oral health screening and silver diamond fluoride application for preschool and primary school children. Develop and distribute oral health education material to different levels of education system. The development of appropriate care pathways to deliver oral health services for older adults and provide oral health care training on the essential package of care for health professionals. Last but not least, Cambodia is looking forward to working closely with the WHO, member state, development partners, and private sector toward universal health coverage, including universal access to oral health care. I thank you, Chair.
Distinguished delegate for Cook Islands.
Thank you, moderator and our panel members, distinguished delegates, ladies and gentlemen, Kia ora. Oral health diseases remain a major public health challenge globally, and the Cook Islands is no different. Investing in both general and oral health is a priority for the Cook Islands. This is articulated in our National Health Strategy 2023-2028. We are committed to engaging with our communities. For instance, our Baby Teeth Matters program, designed to engage our mothers and families, maternal health committees, schools, and communities in the prevention of oral health conditions in our children from birth throughout their school life. Using the Healthy Islands initiatives as a platform, we are able to increase our presence in our schools and promote community participation by reorienting the delivery of health care services with strong emphasis on disease prevention, promoting community participation, strengthening oral health services for all. In saying that, the Cook Islands have been proactive in establishing formal and informal relationships with external partners to support the delivery of oral health care to our people. Ongoing partnership exists with the Bank of the South Pacific, with a focus to improve oral health for our children through the Baby Teeth Matters project. Through this partnership, we are able to improve waiting area for our children and mothers, infrastructure upgrades for dedicated children's cubicles, and distribution of first aid kits for all schools. Colgate has come on board to sponsor toothpaste and toothbrushes for all our children in the Cook Islands. Agreements is signed with all the schools to promote healthy eating. This is where school dedicates days of the school week for shared fruit days and eating together with classmates. We call it 10 minutes to change. The 10 minutes is to instill change to the behavior of children and to enjoy eating fruits together like one big happy family. The toothbrushing program is done daily for all students as classmates. Water bottles are distributed to all students to ensure that they are drinking safe water. ADB, through the WASH program, was able to ensure water stations are available and safe for children. Last year, we started a Cook Islands SMART project in partnership with a New Zealand oral health team in digital dentistry, which the pilot program were in this year in December. The project to date proved to be the future for rural dentistry support to our people in the outer islands. The oral health workforce shortage remain a challenge, a problem that is further compounded by geographical isolation challenges for our people in the outer islands. Investment in oral health workforce remain a priority for our healthcare professionals. The Cook Islands thank WHO Secretariat for having this important topic on our agenda with full support. Thank you, Chair.
Now invite the distinguished delegate for Japan, followed by Micronesia. Thank you.
Thank you, Chair, for giving me the floor. Ensuring access to high-quality oral health and dental care for all is recognized as a critical issue, and Japan welcomes the selection of oral health as the agenda for this panel discussion. In Japan, we have enacted legislation that establishes fundamental principles and goals for promoting oral health. This includes encouraging dental checkups across different age groups and promoting oral health initiatives which have resulted in positive trends, such as a reduction in dental caries among children and an increase in the number of teeth among the elderly. Notably, the 80-20 campaign, highlighted in the working document, reported that in 2022, 51.6% of individuals aged 80 retained 20 or more teeth, meaning 1 in 2 individuals met this benchmark. While efforts to enhancing oral health and dental care services in the rural region are still in their early stages, we would like to emphasize the importance of approaches for each life stage. We also call on the Secretariat to utilize this panel discussion as a springboard for identifying regional challenges and establishing a tangible regional action framework aligned with the Global Oral Health Action Plan. I thank you, Chair.
Call upon the distinguished delegate for Micronesia.
Thank you, Moderator, Honorable Chair, Excellencies, and distinguished delegates. FSM commends the 3 nations that shared their successful initiatives earlier. Oral health is covered under FSM's Healthy Framework 2024-2034 Priority Area 5, held through the Life Course From Womb to Tomb, which targets to reduce morbidity, mortality, and promote well-being. Oral health care has been a long-standing public health priority for the FSM. We look to revitalize the National Medical Dental Association and establish both a National Oral Health Program and a comprehensive national policy for oral health that aligns with the Global Oral Health Strategy and Action Plan. The program will also support in-country training efforts and work to standardize monitoring and reporting processes. To be in line with the 3 regional priority areas, FSM is working to enhance population access to comprehensive family health and life course cross-cutting services like behavioral health, oral health, mental and child health, eye health, and of course, non-communicable diseases. We look to adopt a life cycle approach guided by evidence-based policies, international best practices, and tailored to our context, while focusing on updating standard operational procedures for each level of care, including community education and awareness efforts, while also strengthening monitoring and supervision processes. Collaborating with the education and youth sectors will be essential to raise awareness and promote oral health across communities. Involvement and collaboration from the community at every level will remain a central focus. FSM is committed to the goals outlined by the 2021 World Health Assembly Resolution on Oral Health and urges continued collaboration among member states to ensure progress towards global oral health targets by 2030. Thank you, Chair.
Ladies and gentlemen, we have a few remaining interventions. 1, 2, 3, 5. With your indulgence, Madam Chair, may we proceed with hearing the remaining? Thank you.
Yeah, please go ahead.
Thank you, Madam Chair. Now we'll proceed. We'll call the distinguished delegate for Philippines, followed by Papua New Guinea. Thank you.
Thank you, Dr. Samuel, the Honorable Chair, and distinguished country representative. The Philippines appreciates the discussions on the Global Oral Health Action Plan 2023-2030, especially for oral diseases such as dental caries, periodontal diseases, edontolism or tooth loss, and oral cancer. In the Philippines, Oral diseases such as dental caries, periodontal gum diseases, oral cancer continue to pose significant public health problems, affecting individuals across all age groups. In 2018 National Survey on Oral Health revealed the alarming prevalence of these conditions, with 7 out of 10 Filipinos suffering from dental caries and 5 out of 10 Filipinos experiencing periodontal diseases. Beyond the high rates of these diseases, access to denial to dental care remain a challenge, as 4 in 10 Filipinos still lack access on dental services. While these conditions are not considered life-threatening, they undermine the general health by compromising the body's defense mechanism and facilitating the entry of more serious and opportunistic infections. Additionally, the economic toll of oral diseases in the Philippines is substantial, with productivity losses amounting to approximately $825 million annually. To address these issues, a whole of government and whole of society approach using a health system lens. Oral health should therefore be integrated with other primary care programs and delivered as an integrated services in primary care facilities. In addition, while services are affected by the lack of qualified health workforce for oral health and identified infrastructure and equipment for oral health, these gaps should be approached in a holistic and integrated manner in the context of primary health care. To address these issues, it is imperative that national and subnational systems adopt comprehensive policy standards and guidelines aimed at achieving the highest attainable level of oral health. In this regard, the Philippine Department of Health is implementing 3 key public health interventions. First, focus on the first 1,000 days. Under Republic Act number 11148, we aim to reduce the prevalence of early childhood caries, thereby improving nutritional outcomes for children. This initiative also strengthens oral prophylaxis, caries control, and motivational counseling during pregnancy. Second, the dental home concept. We are promoting continuous, accessible, coordinated, and family-centered oral health care services at the community health center level, aligned with the primary care approach and supported by oral health benefit packages in the near future. Lastly, early habit formation. We are fostering proper toothbrushing habits using fluoride toothpaste through our Healthy Learning Institutions initiative in collaboration with the Department of Education. Additionally, good oral hygiene practices are being promoted in the workplaces through our Healthy Workplaces agenda. In parallel, the Philippines has implemented several supportive policies, including a tax on sugar-sweetened beverages and the development of a national oral health action plan and guidelines, which serve as the basis for the programs and projects in the country towards effective and efficient supervision and coordination with other public health programs and other government and non-government agencies. Lastly, the Philippines recognized that there is so much room for improvement for the country's oral health program. We are committed to transform and strengthen our oral health program with solid governance structure and sound policies and plans moving forward. Thank you, Madam Chair.
Papua New Guinea.
Thank you, moderator. And I thank the regional director for including this important discussion in this forum. Papua New Guinea recognizes the critical challenge posed by oral diseases, which affect over 800 million people in the Western Pacific region, including many of our own citizens. In alignment with WHO's new regional vision of weaving health for families, communities, and societies, we are committed to improving oral health outcomes as part of our broader non-communicable diseases strategy. Oral health issues such as dental caries, periodontal diseases, and oral cancer are on the rise in Papua New Guinea. These conditions have placed a significant burden on our health system, with limited resources, a shortage of skilled dental personnel, and inadequate access to essential dental care. In all provincial hospitals, the prevalence of oral diseases continues to increase, necessitating urgent strategic interventions. Last week, PNG commenced the implementation of a newly launched oral health policy developed in consultation with WHO. This policy represents a key milestone towards strengthening oral health governance and aims to integrate oral health services within our primary healthcare system. The development processes involved WHO funding for consultative workshops with dental offices across our country, reflecting our shared commitment to bolster health systems through collaborative actions. In line with Global Oral Health Action Plan 2023-2030, PNG prioritizes efforts to set risk factors for non-communicable diseases, including sugar consumption, tobacco use, alcohol, and betel nut chewing, which is still very common in part of my country. We plan to expand preventative strategies in schools and communities, drawing inspirations from successful regional models such as Fit for School programs. Engaging families and communities will be central to creating supportive environment that promotes lifelong oral health. Furthermore, to address the gaps in our dental workforce, we seek partnership to enhance skills of dental personnel and expand access to essential oral health services. We acknowledge the need for better research and data collection to guide evidence-based decision-making to ensure that our interventions and targets are in the areas of need. Our national health plan in November, our conference of national health plan national health conference in November, which was initiated again under my leadership as a new Minister for Health. We want to get all the members of Parliament as much as possible and our partners to see the need to address oral health as a major concern in our region. Thank you.
I now call upon the distinguished delegate for Samoa, followed by Vietnam.
Thank you very much, Dr. Samuel Posikai, and your selected panelists, Dr. Cecilia Fifita from Tonga and Dr. Nomi Pinti Hoffman from Malaysia. Samoa would like to reaffirm its commitment to the implementation of the Global Strategy and Action Plan on Oral Health 2023 to 2030, with the following initiatives already being implemented and planned. Firstly, oral health screening in schools had already been integrated as one component of the PENFA Samoa Plus program that is currently rolled out in all districts of Samoa. We heartily acknowledge the support from the government of Japan by donating Samoa mobile dental bus to assist our dental department with their mobile clinics, not only in schools, but also in villages through the PENFA Samoa Plus program rollout. Moreover, The recent finalization of Samoa's first ever national cancer control policy re-emphasized the importance of oral health screening to reduce the number of children being referred overseas for oral surgical and oral cancer treatments. Lastly, the development of a national oral health policy for Samoa is in the pipeline and hopefully will be realized in the last half of this financial year ending July 2025. I would like to tell a short story to end I still have my time. In Samoa, we've been creating a public relation, meeting people, especially the Chokom this week. Talofa with a smile. That means hello with a smile. But a very interesting thing I've noticed, those with missing teeth hardly smile. They can smile but close his mouth or her mouth. But those with complete teeth, they smile with an open mouth. So today, I salute Regional Director for putting this item for the discussion, especially Dr. Samuel Posikai and our well-known presenters, Dr. Cecilia Fita and Dr. Numi Pinti Hoffman. We thank you very much. So I tell you today, we have to smile with your open mouth. Thank you, thank you, thank you.
Thank you. We'll now invite the distinguished delegate for Vietnam.
Thank you, moderator. Honorable Chair, excellent Minister, ladies and gentlemen. During this panel discussion on oral health, Vietnam acknowledged the need for focused action in 3 critical areas. The first area is governance and research. Vietnam recognizes the importance of dedicated governance and research in advancing oral health. More than half of countries in the Western Pacific region lack comprehensive oral health strategies. Vietnam is one of them. Vietnam is committed to providing direction to relevant units within its Ministry of Health to oversee oral health initiatives. Additionally, the country supports fostering strategy partnerships, both domestically and internationally, to secure the necessary political and resource commitment. Vietnam also aims to develop a robust research agenda focused on addressing specific oral health disparities prevalence in its population. The second area is engaging families, communities, and society. Empowering communities through evidence-based interventions is crucial to Vietnam's oral health strategy. The country is dedicated to addressing social and commercial determinants of oral health by promoting prevention strategies targeting tobacco, alcohol, and sugar consumption. Vietnam will work towards creating supportive environments in homes, workplaces, and schools by integrating oral health education and prevention care. And finally, the needs more integration into primary health care. Vietnam acknowledges the fragmentation of oral health services in primary care settings. The country is working to integrate oral health services into its broader non-communicable disease management and universal health coverage to ensure accessible, affordable oral care for all, particularly vulnerable populations. Thank you.
I call the distinguished delegate for the USA territories.
Thank you, moderator, distinguished director, chair, panel, delegates. The USA territories support the regional initiatives on achieving oral health in universal healthcare for the Western Pacific. Oral health in U.S. territories varies due to a range of factors all of you know too well, with respect to geography, socioeconomic conditions, and availability of comprehensive public health resources. Coordinated efforts to improve oral health in our region requires a focus on expanding access to care, increasing workforce capacity, and enhancing preventive health education that recognizes efforts on oral health as working to improve health itself. We appreciate this alignment of WHO Western Pacific efforts to assist with these regional goals. Affordable dental services continue to be impacted by ongoing shortages of specialized oral health professionals and costly equipment and treatments, limiting the availability of critical preventive screening and services. Complicating access remains in fewer options for insurance, particularly among dental benefits for adults, being minimal or absent in certain areas. It is essential we acknowledge that this is counterproductive to pursuits of oral health for all and within all's lifetime. Our work must continue in integrating medical and public health services that implement community-based health programs. Mobile clinics across villages that consistently weave oral health and primary care access have made valuable progress in providing care to underserved areas access to dental services and cancer screenings. We will continue these pursuits. America and Samoa, in absentia, the Commonwealth of the Northern Marianas Islands and Guam appreciate the opportunities ahead for continued efforts towards tangible outcomes on oral health within Health for All. Thank you.
Finally, but not least, I call upon the distinguished delegate for the Solomon Islands.
Thank you, moderator. I would want to start by saying the Western Pacific region lies in the Western Pacific region's beauty lies in oral health. Therefore, our investment to oral health is important. We should be smiling by participating well in the investment rounds because we cannot lose our beauty. Chair, I thank the Secretariat for including oral health at this regional committee meeting, as without it, we cannot achieve the ideals of health and well-being. In Solomon Islands, oral health services are generally free, except for detaches where patients have to pay some fees. On one hand, this is great for patients. On the other hand, we could not keep up with the high demand due to the high cost of dental equipment and consumables. We have dental services at the National Division at the National Hospital and is responsible for the provisions of oral health services in Solomon Islands. The Dental Division has a dedicated budget for service delivery at both the national level and subnational levels. The full range of services are available mostly at our National Referral Hospital and to a certain extent in our provincial hospitals. Our oral health services are integrated into primary health care delivery. In our effort to achieve universal health coverage, we intend to provide basic oral health services at area health center levels as per our role delineation policy. However, implementing this policy has been very slow due to resource constraints. Therefore, in order to improve oral health services coverage, we prioritize outreach program at the subnational level. For school-based activities, we are targeting school children, especially primary schools. School-based program usually includes oral health screening, health education, include toothbrush demonstration, distribution of toothbrushes, and providing preventive treatment, such as the application of topical fluorides and fixes sealants. In response to the global strategy on oral health and the Global Oral Health Action Plan 2023 to 2030, we are developing a national oral health policy 2025 to 2030, which we hope to launch in 2025. At the same time, we are working in collaboration with the National Non-Communicable Disease Program so that oral health is also integrated into the NCD policy 2025 to 2030. We urge WHO to support member states, particularly in area of research, to better understand our oral health status to help build the evidence-based policy development and planning for the future. We also aid WHO to provide technical support to integrate oral health in National Health Information System, because as I said, our beauty in the Western Pacific region lies very much on oral health. Let us all smile. Thank you, Chair.
Thank you, distinguished guests, for your valuable contributions. As we conclude, I would like to express my sincere thanks to all speakers, our panelists, member states, and participants for your active engagements today in terms of making history as well on this agenda. Your dedication to advancing oral health to our region is truly inspiring. To finally reflection, I would now am pleased to invite Dr. Hiromasa Okayasu, the Director of the Division of Healthy Environments and Populations at WHO Western Pacific, to deliver the closing remarks on behalf of the Secretariat. Over to you, Doctor.
Thank you very much, Dr. Posikai, for your excellent facilitation as well as the presentation. I also extend my gratitude to the member states, so many of them, sharing their experiences and commitment to improve oral health in the Western Pacific region. In the opening, our regional director highlighted the significant but preventable burden of oral diseases in our region, then identified 3 key priorities: political commitment, governance, and research through national policies and strategies, promoting oral health throughout the life course, and then integrating oral health into the primary care. Many countries have already made significant commitment for oral health. For instance, Vanuatu revised its national oral health policy to expand access to care, and Gadafara Smile Nurse program, and then align with the NCD strategies. Korea established a basic plan for oral health projects to expand coverage throughout the life course. China also shared their experience with the oral health action plan, including governance, family and community engagement, and integration into primary care. Cambodia adopted the National Action Plan for Oral Health to expand school health initiative and service for children and older adults in particular. Micronesia also developed a national plan with the National Dental Association and then national campaigns. On life course oral health promotion, Tonga made a presentation on the Mari Mari program, which fosters oral health, especially through school and community-based initiative. The Philippines implemented the first 1,000-day program to reduce early childhood caries and a healthy learning institution to promote brushing habits. Samoa integrated oral health screening in schools through the PEN program supported by the mobile clinics. And Japan's 80-20 campaign, including public awareness, school programs, and community involvement, has reduced the burden of oral diseases both in children and in adults. Fiji shared their experience in promoting oral health alongside NCD prevention, such as sugar and sweet beverage taxes. Cook Islands shared their experience in school and community-based health program. Papua New Guinea described promoting oral health through schools, partnership, and then NCD prevention programs. And Vietnam's approach emphasizes social and commercial determinants as part of the NCD prevention program. Countries also shared their experience in integrating oral health into primary care. For example, Malaysia integrated oral health into primary care with clinical guidelines, innovative workforce models, and then health information system for sustainable services. And then Hong Kong, China provides oral health services at clinic and in mother-child health centers, including support for underserved population. Brunei Darussalam mentioned the universal access to oral healthcare services with the travel teams. U.S. territory emphasized the importance of insurance coverage for basic dental services, especially amongst remote and vulnerable populations. Solomon Islands explained their efforts to integrate oral health services into hospitals and clinics and then reach out. And then these examples represent important strides to address the oral health in our region. WHO remains committed and looking forward to working with all the member states in our regions on these priorities to achieve better oral health outcomes and a healthier, more equitable community and in society, as well as healthy smile across the region. Thank you very much.
Thank you very much, Dr. Piukala, Dr. Okai, Iyasu, Dr. Tapo, and all of the panelists. Before we break for lunch, may I remind the committee that there will be a briefing session on the Health for Life Fund here at the plenary hall. Let's start that at 1 p.m. May I now call on the Director, Administration and Finance for the administrative announcement, please. Sorry. So now we will break for lunch and reconvene at 14 this afternoon. Thank you very much.